There's a question here from somebody who's been newly diagnosed. It's about clinical trials. Are they suitable for people who have been newly diagnosed or early stage
Yeah,
PSC
no,
patients?
they are. Most clinical trials don't have any restriction on the time of diagnosis, although some of them do have a restrict. So once again, it's all about the definition of the disease. Some studies, you have to have had abnormal liver blood tests for 6 months before you go into them. So some of them, most patients will be able to get into a study if they're relatively newly diagnosed, but it does come down to the individual study and the disease definition. Because often, as I say, for some reason at the moment, most of the studies do target large duct PSC,
Mhm.
and some of them do insist that you've had an abnormal liver blood test for 6 months before entry as part of your disease definition. You have to have had abnormal blood tests for that time to say you've definitely got PSC. As well as importantly, and I didn't really just catch on it, there are, of course, when you've got an abnormal MRCP looking like those sort of scarred tubes that are going out with that large duct change that helps you make a diagnosis, there are things that, of course, can mimic that. There are other diseases that can look like PSC. And there's another job that I have in the clinic is making sure that I'm not missing anything that's, or if you like, mimicking PSC in disguise. So I think once again, in your center, see what studies there are. Most, I hope, in places that offer studies will always send you out the information sheets for those studies. And of course, most patients that get enrolled in studies go through a screening period where clinicians who run those studies have to check that the patient meets the entry requirements. Now, sometimes, during a screening process, you find a reason why a patient can't continue. But I would just ask your clinician and the nurses who run the studies to send you the information, and also to look once you've obviously signed a consent form if you're validated as you go through the screening process.